everyone, and welcome back to another installment of Nina Case Studies series. In today's episode, we'll be discussing the issue of low back pain, which often accompanies menstrual period pain caused by adenomyosis. This type of low back pain is usually a result of pathological changes in the muscles around the uterus and pelvic area, which can affect the muscles around the spine. Every time Nina comes in for a treatment session, we closely monitor her progress and compare the changes we observe during her visits. As part of our assessment, I always check her tongue and pulse to track any developments. Typically, the changes become quite apparent within the first few visits. So, let's dive into Nina's fifth visit and see what we discovered. Take a look at Nina's tongue on her fifth visit. Can you notice the differences in shape and coating compared to her first visit? These changes indicate an improvement in her period pain. In fact, Nina herself mentioned her period pain wasn't as severe as before, although she still needs some Panadol to alleviate it. As a result, we adjust the Chinese herb formula based on her tongue and pulse. The modified formula looks like this. During Nina's treatment, she mentioned that she experienced some trouble in her lower back. As I mentioned earlier, this type of low back pain can be attributed to her underlying adenomyosis. To address this, we decided to focus on her low back pain during the sixth visit, using acupuncture and cupping methods. Now, I'm sure many of you have experienced acupuncture before. Another similar needling technique often mentioned is dry needling. Have you ever wondered about the difference between acupuncture and dry needling? If so, I have an Instagram post that provides an answer to this common question, which you can check out later. Acupuncture involves working on the meridians. In Nina's case, her low back pain primarily occurred along the bladder channel. Now take a look at the picture. The bladder channel starts from the inner corner of the eye, goes up and over the top of the head, descends along either side of the spine, passes through the sacrum, travels down the back of the lower limb, and terminates at the outer border of the little toe. There are a total of 67 acupoints along this channel. Considering Nina's constitution, I selected specific points called Kunlun and Weizhong to alleviate her low back pain. It's similar to the principle of leverage, where a lever can amplify an input force to provide a greater output. In our clinic, we also employ traditional cupping techniques. As you can see, I quickly place an ignited cotton ball into a glass cup and promptly place the cup on the selected acupoints, creating suction to stimulate those points and achieve a pain-relieving effect. During this section, we used acupuncture in conjunction with cupping to treat low back pain, but we didn't perform acupuncture for Nina's period pain to avoid interference with the acupressure points for her lower back. However, we did apply E-seating technique to address her period pain issue as shown in the photo. The reasons we didn't combine acupuncture for period pain and cupping for lower back pain in the same treatment session is that they can interfere with each other's effects. Chinese medicine is all about the guiding of qi, which involves employing different methods to direct the qi to specific areas to address health issues, one at a time. An analogy would be a general in the army concentrating military forces to attack one single target to achieve victory. The concept of qi can be understood as the energy that organizes the movement of all parts of the human body. If you would like to learn more about the concept of qi or Chinese medicine in general, make sure to follow us as we may create more contents on this topic. By watching this video, I'm certain you now have a good understanding of the various Chinese medicine techniques we employ to assist our clients. If you have any questions or would like more information, please feel free to leave a comment down below. Thank you for joining me today, and make sure to stay tuned for the next episode, where we will delve deeper into the topic of menstrual period pain caused by adenomyosis. Until then, take care and see you soon.